Diagnosis, evaluation, and case history making. The various objectives of this prosthodontic treatment includes elimination of the disease, preservation of health, restoration of lost teeth, and oral function in aesthetic manner. The fixed prosthodontics is a branch of prosthodontics which is concerned with the replacement or restoration of teeth by artificial substitutes. They are not readily removed from the mouth. So usually they have three important parts. One which is the pontic, they are the artificial teeth of a fixed partial denture that replace the missing natural teeth. Retainers are the part of fixed partial denture that unite the abutments to the pontics and surrounds all are part of the prepared crown. Connectors which join the pontic and retainers together, and the abutments, which is a part of the teeth that support or retain the processes and receives the direct masticatory load from opposing parts. Residual ridge is a portion of the residual bone and its soft tissue covering. So in this, pontics, retainers, and connectors, these are the parts of fixed partial denture. Abutments and residual ridge are seen inside the patient's mouth. Moving on to the diagnosis and treatment planning. What is diagnosis? So it is the determination of nature of disease process. What is treatment plan? The sequence of procedures planned for the treatment of a patient following diagnosis. So this helps to decide the prognosis of the patient. What is treatment? It is a measure designed to remedy a careful evaluation of all available information, a definitive diagnosis, and a realistic treatment plan that offers a favorable prognosis. So there are seven important elements which is going to have a good diagnostic workup. Chief complaint, vitality testing, history, extra oral examination, intraoral examination, diagnostic cast, and radiographic evaluation. First is the chief complaint. It should be recorded in patient's own words. The accuracy and significance of the patient's primary reason should be analyzed first. So that helps to reveal the problem and also helps to understand the underlying condition and the need for the patient in that time. So that can be analyzed by using the chief complaint. So the second is the chief history. So the patient's history that should normally include the past medical, the past dental experiences that should be given consideration while we are getting the history report from the patient. A screening questionnaire is useful for history taking. Then the medical history. So an accurate and current general medical history should be included regarding any medications they are undergoing because certain conditions can have a contradictory effect over the dental treatment plan. So this history is more important while you go for the treatment planning. Next is the dental history. So the significant patient's periodontal, the restorative endodontic history should be noted. The orthodontic history, if it is there, that should be assessed and the this because this is going to help in rehabilitating the prosthodontic part based on that. Next is the extraoral examination. During extraoral examination, cervical lymph node, temporomandibular joint, and all the muscles of mastication should be palpated and evaluated. The temporomandibular joint, normally it is palpated bilaterally just anterior to the auricular trachea. So during mandibular movement, clicking, crepitus or alteration of the range of joint is noted that shows there is some underlying pathologic condition in the temporomandibular joint. So without ruling the problem in the temporomandibular joint, we cannot go for prosthetic replacement. Maximum jaw opening, if it is less than 40 millimeter, that shows there is a restricted mouth opening. And the average mouth opening is normally greater than 50 millimeter. So if there is a reduced mouth opening, the underlying cause should be evaluated and the treatment should be given for that to overrule the condition. Any deviation from the midline should also be recorded. The maximum lateral movement can be measured. Normally, maximum lateral movement can be can be up to 12 millimeter. Muscles of mastication. So there should be a brief palpation of all the muscles of mastication, especially the masseter temporalis, the medial pterygoid, lateral pterygoid, trapezius, and sternocleidomastoid muscles. So this helps to find out the underlying condition or any excess pressure that is revealed over area, and the patient may demonstrate the limited mouth opening due to the spasm of the masseter or temporalis muscle. So that should be evaluated. The underlying cause should be ruled out before going for the replacement of the artificial teeth. Next is your intraoral examination. So the patient's general oral hygiene should be observed first. any presence of any abscess, inflammation, or any form of gingival architecture changes in the stippling, or any pocket formation in the periodontal area, all these should be recorded, and the underlying condition seriousness should be evaluated. The level of these conditions should be examined, and that should be cross-checked with your patient's history and also the diagnosis part. So the presence and amount of the tooth mobility should also be recorded with special attention paid towards the relationship with the occlusal prematurities and to potential abutment. So next is your radiographic evaluation. So radiographs, which is very important to provide the information that helps to correlate all the facts that have been collected in listening to the patient. So examining the mouth and evaluating the diagnostic cast. So this radiographs helps to find out the crown root ratio of the remaining abutment teeth and the length, configuration, the direction of the roots also can be examined. So this helps to identify or to find out the abutments which can be chosen for your fixed partial denture. Next is your widening of the periodontal ligament. So that should be correlated with the occlusal prematurities or occlusal trauma. So if there is a reason that is the occlusal problem that is creating such type of periodontal ligament widening, then that particular attention should be given to that particular condition and that should be corrected. So you can see a picture which is related to the IOPA, that is the intraoral periapical radiograph, to obtain and see the condition of the existing processes and also the root length, the contour, the periodontal ligament support, the presence of any inflammation. These can be evaluated by using the radiographs. Next is your vitality testing. So prior to any of the restorative treatment, the pulpal health must be assessed. Usually, this will be measuring the response to percussion, thermal, and electrical stimulation. So this is very important before you go for the placement of a fixed crown. So next is the diagnosis of non-vitality. So that can be confirmed by preparing a test cavity before the administration of the local anesthetic. Then electric pulp tester can also be used to check the vitality of the pulp. Then the most important thing is the diagnostic cast. Articulated diagnostic casts are essential in planning the fixed prosthodontic treatment. So they help to visualize the teeth both in the lingual side, both from the inner side, outer side. So these evaluation and the positioning of the teeth, the occlusal arrangements, everything can be visualized in the diagnostic cast. So this is very much important in the treatment plan procedure. So the critical information not directly available during the clinical examination, static, dynamic relationships of the teeth. So these things can be verified by using the diagnostic articulated diagnostic cast. So they also helps to reveal the accepts of the occlusion which is not detectable within the confines of the mouth. Thank you.